I kind of want to start a little bit back in time. I think this is yesterday's news, and then we can get to everything that happened today. The questions over the vaccine schedule for kids. This is something that anybody who has a young kid knows. You look at this thing, your doctor looks at this thing and says, okay, these are the recommended vaccines at this age. They work in tandem sort of with the American Academy of Pediatrics, I believe. What's happening with this from Washington right now?
Right. So the American vaccine schedule is recommended by the CDC, not required. But I think for most people, you just kind of go with what your pediatrician tells you, and that's where it comes from. What we learned yesterday is that the CDC's group of vaccine advisors intends to reopen the book on the vaccine schedule, which in the abstract, kicking the tires scientifically on something like that seems perfectly reasonable. The reason for the alarm that you may have heard from public health officials is that this is a handpicked group by Robert F. Kennedy Jr., who famously has advanced and espoused debunked theories about the safety of vaccines going back to the 1990s, if not before. So people are reading the tea leaves. Is this an attack on the vaccination of young kids, which is something Kennedy has fixated on for many years and tied various vaccines to the development of autism and other issues for which there is just no evidence? So the concern is that when they reopen the book, their consideration of the evidence behind, for example, the measles vaccine or anything else that's recommended for young kids will not be even-handed, and that this could be a kind of breadcrumb trail to a dismantling of public health in the United States.
Well, how does it work in the panel? What evidence are they looking at? What research are they looking at? What goes into determining their decision, or is it kind of how they feel?
It's pretty rigorous. So there's a multi-step process. Any new vaccine, which at some point each of these vaccines was new, must first win approval from the FDA, which looks at safety and efficacy also pretty rigorously. And then it goes to this panel of independent advisors to the CDC, the Centers for Disease Control and Prevention. They pour over even more of that data and look at things beyond what the FDA looks at, including the cost and cost effectiveness of these things and real world evidence as to how safe they are, how well they prevent disease, and what side effects they may have.
The U.S. does not have the only children in the world.
Right.
There are children all over the world. I'm wondering how the U.S. vaccine schedule is different than vaccine schedules in other parts of the world.
So at least against like the big 5 European nations, they're pretty much the same. We all vaccinate against about 15 of the same childhood diseases. There is some difference in like hepatitis A, hepatitis B, basically based on prevalence in different countries. Some countries, that's more of a risk for young kids than it is in others for all kinds of reasons. The number of individual shots you get varies, and the US has more of those than, for example, Germany or the United Kingdom. This is a little bit in the weeds. Even though we're vaccinating against largely the same diseases, in Europe there are more combination vaccines that we don't necessarily use in the US. So the number of needles varies, but I would say by and large, Japan, other comparable nations, we are trying to prevent the same diseases in our kids.
So they're basically giving a shot that may cover numerous things.
Right.
Whereas we are doing individual shots.
Yeah. And
Why is there a difference?
You know,
I mean, if I have a little critter, I don't want to.
Fewer needles, the better.
Yeah, exactly.
You know, it really does.
I did have a little critter. She's a big critter now. But I mean, yeah, like that was something you wanted to limit as much as possible.
Right. And it boils down to basically, you know, the way that like reasonable people can disagree. Different groups of experts will look at safety and risk and cost differently. So one example is measles. In the United States, we recommend the MMR vaccine, which is measles, mumps, and rubella, and then the chickenpox vaccine separately. There is a vaccine that has all 4 of those things together. It can lead to, in small numbers of cases, seizures. And the CDC decided years and years ago, better to do them MMR plus V is what they call it. Overseas, it's largely, or in many cases, MMRV. And there are other cases like that where basically reasonable people, sort of equivalents of the CDC in countries around the world, came to different considerations. And some of this does have to do with cost.
Does it seem like the Secretary of Health and Human Services is fulfilling promises that he made as he was testifying? If we remember back a few months ago, it was pretty contentious, and there were some holdouts who ultimately ended up supporting him because they said, hey, he will not do the things that the worst critics are saying he will do.
Right. The short answer is no. I mean, one specific case is, as you mentioned, it was Senator Bill Cassidy from Louisiana, who ended up being
a doctor.
Who is a doctor, and clearly was, or at least in public, seemed very pained over this vote,
That's
over
who I
whether
was
to
thinking
confirm
of.
Kennedy, and ended up being basically the deciding vote as a result. And in order to get that vote, according to Cassidy, Kennedy promised him explicitly that he would not mess with this particular committee on the CDC.
Oops.
Now that's according to that's according to Cassidy. Kennedy did not, to my knowledge, say that publicly, but I think we can trust the senator, or at least we have little choice but to. Cut to this June, Kennedy fired all 17 of the standing members of this committee and replaced them with 8 people, one of whom resigned before the first meeting. So the remaining 7, and they include people with non-traditional backgrounds, not necessarily MDs or vaccine experts, and in a few cases, people who have, like Kennedy, echoed those debunked claims about vaccines causing autism or other safety risks.
Well, some would say that a panel should have diverse points of view, right? So that you get a healthier debate. Having said that, is it typical that an administration changes this panel completely? I mean, it does change over time, right?
It does. They're appointed to 4-year terms by Health and Human Services secretaries, and it's considered, serving on this committee is like a real badge of honor in public health. Whether you're a vaccinologist, a pediatrician, a registered nurse, it's almost like a minor league baseball system. You will serve on the working groups that serve this committee, and then to be selected
there's a farm team,
is an honor. It kind of, yes. So to liquidate, maybe not the right term, to fire outright all of the standing members and replace them, that is unprecedented.
Go ahead.
The one thing I wanted to get to is that they may not provide the U.S. funding for vaccinating children in poor countries. As we learned with the pandemic, pandemic doesn't know a border. And I wonder about this. So what's top of mind for you? And forgive us, it's only 30 seconds.
No, that's all right. The separate issue, so as you mentioned, Kennedy announced that the United States will no longer fund Gavi, a program that was founded in part by the United States to vaccinate children around the world. This is cause for serious alarm around the globe. As you noted, the next COVID is not something that will just stop because of a border. We need to see what the knock-on effects of this are, but the United States pulling out of funding as the major funder is a serious concern.